My name is Chuck Novak, and I am Technical Laboratory Supervisor at Boulder Community Health. We're a 165-bed hospital, but our volume that comes into the lab gives us the volume of a 400-bed hospital. And we run about 4 million tests in a typical year.
My name is Wayne Thomas. I'm the Chemistry Technical Lead Technologist at Boulder Community Health. The laboratory is extremely important to the hospital, and we basically have extensions throughout the city and county of Boulder, and we do the lab work for pretty much all of it.
The mission of the laboratory is to provide excellent service to the providers, to the patients, and to the community. So we've had a solid relationship with Ortho Clinical Diagnostics for probably over 35 years now. I think a lot of the success at Boulder Community in the laboratory is because the ortho instrumentation in the chemistry and the blood bank has really put us a step above other hospitals and our competitors.
We have two 5600s on our automation line. We have one 7600 that we use for special chemistry and hepatitis HIV. And we just received our two new 7600s, which will replace the two 5600s that are on the line right now.
The ortho analyzers are very reliable. We have microslide technology, which does the main chemistries, which you calibrate once every 6 months. They hold their calibration. They produce reliable, accurate results for the immunoassay, cardiac markers, hormones. We use microwell technology. We use microtip technology for drugs of abuse and immunoglobulins, and the results are very reliable.
I believe that the ortho instruments are one of the easier analyzers to use.
The analyzers are very reliable, not much downtime. If you're doing 4 million samples a year, you are running thousands of samples a day. And if you can keep that going and not have the analyzers going down, then the techs are happier, the overall staff is happier. About every 5 years, we do a comparison. We look at other chemistry analyzers, we look at other blood bank analyzers, and having developed a relationship and knowing, for me as a supervisor, that we're putting out results that I can trust is huge.
We did go with the Ortho Automation, their track system. The front end staff basically loved it from the start because it's more efficient for them and it basically runs itself. The techs, once they got used to it, they liked it a lot.
Earlier, we had someone that was in front of the chemistry analyzer, and that's where their focus was. They couldn't walk away, and now that person can now go help out another tech in another area, or they can do their own projects. It's an overall employee satisfier.
The automation will definitely benefit the entire hospital system, and I think the secondary benefit comes with the physicians. The physicians know that they send a specimen over to BCH. Within 2 to 3 hours, they're going to have results. And since we have a large availability of analytes, the physicians don't have to order it stat to make sure that they get it back the same day.
So in this COVID environment, it's crucial to provide COVID testing. So when Ortho came up with the COVID testing, it was a relief that we had a vendor that we trusted, that we could trust the numbers that they provided us for the specificity and the sensitivity. It was easy to make the transition to bring in the antibody test from Ortho.
And the release of the antigen test, I think, will have an even bigger impact. The antigen test, we can have turnaround times of between 1 and 2 hours. Again, it will free up a lot of time, effort, and in most cases, money. You get one tube, you put it on one instrument, you get one set of results, you release them, and away they go.
So at Boulder Community Health and the laboratory, we do feel a sense of partnership with Ortho and the people that work at Ortho. And I will tell you, the reps and the service people have a lot to do with our decision going forward on an analyzer, and the customer service that they give us, excellent customer service, none better.
It's extremely important that not only the laboratory, but that the people who are supporting the laboratory, in this case Ortho Clinical Diagnostics, holds the philosophy that you never forget that a specimen is directly related to a patient and that their outcome depends on you.
The instrumentation makes a huge difference. And I expect that we will be working with Ortho Clinical Diagnostics for years and years to come.